Hello, I'm Dr. Pamela Ruegg, and I hold the David J. Ellis Chair in Antimicrobial Resistance and Large Animal Clinical Sciences in the College of Veterinary Medicine at Michigan State University. And I am very pleased to be joining colleagues from all around the world from multiple disciplines in this GARD Innovation Forum discussing antimicrobial resistance and antimicrobial stewardship. As we begin this topic, I want to start with some facts from the World Health Organization. The first fact is that the World Health Organization has declared that antimicrobial resistance is one of the top 10 global public health threats facing humanity. The remarkable thing about this fact is that they made this in October 2020 as the COVID pandemic is wreaking havoc on public health throughout the world. So as we've dealt with this COVID outbreak, I think it's important for us to recognize that there's other emerging threats to public health, and we can't neglect those issues as we move beyond COVID. Second fact from the World Health Organization is that antimicrobial resistance is a global health and development threat, and I really want to emphasize the word development. Research from around the world shows that similar to the COVID pandemic, the effects of antimicrobial resistance on populations of humans and animals are disproportionately felt in developing and lower income countries and communities. Therefore, we have to work together in order to reduce the risk and the negative impacts of the emergence of these resistant organisms. World Health Organization states that misuse and overuse of antimicrobials are the main drivers in the development of drug-resistant pathogens. And this is a simple statement that overlies a very complex system. Understanding when to use antimicrobials, understanding the cultural context of that in both humans and animals, ensuring that we have appropriate diagnostic tools, and laboratories and guidance and properly educated practitioners is very vital to reducing the threats from antimicrobial resistance. Another important issue about antimicrobial resistance is it's costly. The cost of antimicrobial resistance is very significant. You've got death and disability, but you also have things we've seen in the COVID epidemic, things like the longer people are ill, the longer they're in the hospital, the more expensive medicines they need, and the impact of fighting illness creates huge financial challenges. And again, those challenges are often felt at the lower end of the income scale and have a bigger impact. The best way to prevent the emergence of antimicrobial resistance is to keep animals and people healthy. And this fact from the World Health Organization stresses that we have to continue to understand that the lack of clean water and sanitation and inadequate infection prevention and control promotes the spread of bacteria. And when we promote the spread of bacteria and get more disease, we promote the spread of resistance. So we have to emphasize this holistic emphasis on prevention and maintaining health. And then finally, we've got to recognize that antimicrobial resistance reduces the tools we have to fight disease. And that is not only diseases and conditions that are caused by bacteria, but we also reduce our ability to use antimicrobials and prevent infections during major surgery, and we impact people undergoing chemotherapy who become immunosuppressed. So we have really broad effects of antimicrobial resistance that go far beyond just bacterial disease. Now, there's three key concepts I want to make sure that we have on the table for our discussions today. One is antibiotics are vital for treatment of bacterial diseases. And when we're using antibiotics properly, we are treating a known actively dividing bacterial infection. So the use of diagnostics, the use of an exam, tools to diagnose appropriately when antimicrobials are needed and which antimicrobials are needed are vitally needed. Secondly, as we've mentioned already, prevention of bacterial diseases is the best way to minimize use of antibiotics. So we can't just focus on diseases after they occur. We have to have resources devoted toward preventing bacterial diseases in both humans and animals. And then I want to point out that antimicrobial resistance can occur intrinsically, and that intrinsic resistance isn't really a human health risk. Intrinsic resistance is defined as the natural ability of a bacterial genus or species to evade antibiotics. The key thing here is we want to make sure that we're treating the right bug or pathogen with the right drug. And to do that, again, we need appropriate diagnostics and appropriate support for medical professionals. Acquired resistance is the one that is the threat to human health, and that is when previously susceptible strains of bacteria mutate to become resistant and then can spread beyond that person. Now, the Center for Disease Control has created this great graphic that shows a description of how antimicrobial resistance spreads in communities. And I think this graphic is remarkable because it demonstrates the interconnectedness of antimicrobial usage in human populations and animal populations. So at the top of this graphic, you see humans or animals receiving antimicrobials. You've got selection goes on, but the real key thing here is the interconnectedness of how resistant populations can spread between those two communities. And one of the key things that I have come to recognize is that antimicrobial resistance sits at the very center of this One Health concept. And it's so complex because we've got human dimensions, we've got social and environmental dimensions, and we've got animal health and productivity issues. And all of these in this complex system need to be addressed. Some of the human dimensions are, why are antimicrobials used? What do people believe about their efficacy or their need? How are decisions made to prescribe or take antimicrobials? When we look at communities where animals and humans are tightly woven together, do farm workers infect the animals? Do animals infect farm workers? How do we motivate change, and how do we minimize risks? When we look at the social and environmental dimensions and issues, some of these are at a geopolitical level. How much antimicrobial usage in animals is necessary to maintain animal and human welfare? Who diagnoses and treats diseases? Who has access to antimicrobials, and who decides which antimicrobials are going to be used? Throughout the world, we have a huge variety of drug regulations, and we have multinational corporations who produce food who are interested in regulating that. And then finally, what sort of practical steps can we take to reduce the risk of dissemination of antimicrobial resistance? Among the human aspects, the social and environmental, and I like to wrap it all up in saying we need to move rapidly toward evidence-based antimicrobial usage. So with that, I'll wrap it up and look for the next speaker and look forward to our discussions.